We're going to head off now to the Granite State, where the gentlelady from the 2nd District of New Hampshire has been waiting patiently. Representative Kuster, you're recognized for 5 minutes.
Thank you, Mr. Chairman, and to our ranking member, I appreciate your taking the time for allowing me to speak about a topic that's important to me and my constituents in districts all across the country. There's nowhere I go in New Hampshire at this time where I'm not meeting and talking with folks who have been intimately affected by the opioid epidemic that's devastating our state. This crisis is certainly not limited to my district. In recent months, I co-founded the bipartisan task force to combat the heroin epidemic, to advocate for policy solutions to this crisis, which has grown to historic proportions. There are already over 50 members who have joined our task force from both sides of the aisle to help raise the profile of this issue in Washington. Across our districts, we're seeing communities struggle to deal with the issue. Our medical providers can't keep up with the flow of overdoses entering their clinics, and there's simply not enough capacity to secure treatment for those who need it. Our law enforcement and first responders have taken on the burden of responding to more and more potentially dangerous situations when a call for help comes in, and these calls are becoming more and more frequent. Statistics now show that more Americans die from drug overdoses than car crashes. In New Hampshire alone, the opioid epidemic continues to grow. In 2015, there were roughly 400 drug deaths in the Granite State, surpassing the current record the year before of 324. Without quick action, these numbers will continue to rise. We face a deadly combination in New Hampshire, having the highest per capita addiction rate, but the second lowest treatment capacity. Recently, I highlighted the tragic results that can occur as a result of the lack of treatment options in a special order on the House floor, telling the story of a young woman named Amber who passed away at just 22 years old. While incarcerated and craving treatment, a bed became available for Amber at a highly regarded and respected facility. But the prison would not let her out to take the bed, and when she was released, the bed was no longer available. After leaving prison, Amber had to lie to get help in an emergency room, saying, "I want to kill myself," when the reality was that her substance use disorder was killing her. She detoxed in the hospital, but no recovery or aftercare was offered. And when she went home on the third day, she said to her parents, Chris and Mark, she was leaving to go back to her people on the street. Sadly, she died shortly thereafter. The lack of treatment is resulting in deaths across the state, and it's critical that we act in conjunction with state efforts and first responders, law enforcement, caregivers, and mental health experts to provide the resources necessary to save lives. We need a plan and coordination at the federal level leading to improved prevention, treatment, and lifelong recovery. We need better prevention through strengthened enforcement and cracking down on drug traffickers and helping our cops and first responders keep heroin off the streets. We need resources to help states work together to monitor prescription drug use across their borders. We need resources and policy changes to help doctors improve their prescribing practices so that patients can better manage pain without becoming dependent on opioid medication. And we need more detox centers, treatment beds, social workers, mental health professionals to help those affected by opioid use disorder to transition to and stay in recovery. No single idea or amount of resources will provide a silver bullet to this challenge, but by working together in a bipartisan manner, I'm confident that we can act to give our communities the tool they need to stop this epidemic. There's so many amazing caregivers, law enforcement officials, and advocates working to stem this crisis who simply need additional help and resources. So I ask that as you work to craft your budget for fiscal year 2017, you focus on meeting the critical needs posed by the heroin epidemic so that we can save lives and protect communities all across the country. Thank you for the opportunity to testify, and I yield back the balance of my time.
Thank the gentlelady for her testimony this morning. Mr. Yarmouth.